Welcome back, everyone. So, we're looking at something you might not think about every day: pediatric waiting rooms. Turns out they're more than just places to sit and flip through magazines.
Right. They're actually part of the care delivery process. When a child enters a waiting room, that environment immediately starts influencing their stress levels, anxiety, and even how well they'll cooperate during the appointment.
Interesting. So, it's more than keeping kids occupied while parents fill out forms?
Exactly. Research shows that about 25% of kids coming to a dental clinic have moderate to severe anxiety. That stress can affect their pain tolerance and cooperation during treatment, potentially influencing factors like the amount of anesthetic needed and the overall length of the procedure.
Wow. And I'm guessing that stress isn't limited to the kids?
Definitely not. Parents carry their own worries, health concerns, financial stress, maybe they're running late. Then you've got staff managing high workloads in time constrained environments. All of that emotional weight spreads. There's this phenomenon called emotional contagion where negative emotions ripple from patients to providers and back again.
So, everyone's stress kind of feeds into everyone else's. How does that impact actual decision making?
Well, stress impairs executive function, things like attention, working memory, cognitive flexibility. For a child, that means they might struggle to listen or process what the doctor is saying. For providers, stress and burnout can impair attention and memory, increasing the risk of errors and impacting patient safety.
That's intense. So, what can facilities actually do about it? I mean, you can't eliminate stress entirely.
True, but you can design the environment to reduce it. One key area is media. A lot of waiting rooms default to news or neutral programming, but negative media rapidly induces stress, anxiety, and fear. Even content that isn't explicitly negative can lead to boredom, which research suggests can be a mild stressor.
I hear you. So, what should they show instead?
Positive media, nature scenes, or kindness themed content. Nature media has been shown to relax viewers, decrease heart rate and blood pressure, and improve attention. Kindness media goes a step further. In a pediatric dental clinic study, parents and staff who viewed kindness media felt more inspired, happier, calmer, and even more generous compared to those watching standard children's television.
That's pretty cool. And I imagine the physical environment matters too.
Absolutely. Natural light, plants, or even images of nature can decrease reported anxiety and stress. Studies show that patients who had windows in their hospital rooms recovered faster from surgery. Natural light and views of nature are generally associated with improved well being and reduced stress in healthcare environments for both patients and staff.
So, practical things like better lighting and some greenery can genuinely move the needle. Have you ever walked into a waiting room and just felt calmer?
Yeah, absolutely. And it's more than aesthetic. These changes support healing and cognitive function. For example, viewing nature images helps restore attention after stress, which is critical when patients need to absorb new information or make decisions. Restoring attention after stress, that's something we often overlook, but it directly affects how well someone can focus and engage.
That point about restoring attention after stress sets up our next piece: how to engage kids directly. But first, a quick word from our sponsor.
Little People's Cove specializes in commercial grade furniture and activity toys designed for pediatric offices, dental clinics, hospitals, and therapy centers. Our solutions help reduce anxiety, encourage independent play, and eliminate the challenges of loose toys. Every product is selected for durability, safety, and easy maintenance, making them ideal for high traffic healthcare environments. Find tools that support calmer visits and smoother operations at littlepeoplescove.com.
Picking up on that idea of restoring attention after stress, how do you actually keep kids engaged in a way that supports their development?
Wall mounted activities and sensory panels work really well. They're interactive, durable, and easy to clean. Kids can interact with textures, gears, or bead mazes, activities that redirect their focus away from medical anxieties. The key is age appropriate design. Toddlers need different challenges than school age kids.
And I assume safety is huge here. No small parts, non toxic materials, smooth edges.
Right. For pediatric waiting rooms, it's important to select toys that are durable, easy to clean, and meet recognized safety standards such as ASTM or CE certification. This ensures a safe and hygienic environment. Hard plastics, silicone, or well-finished wood are easiest to sanitize. Avoid plush items in high-traffic areas. They retain germs and are harder to clean thoroughly.
Makes sense. So, if a practice manager is listening right now, what's one thing they should prioritize?
Start with the media. Swap out news or neutral programming for positive content. Then look at your lighting and whether you can add natural elements. Finally, invest in durable, wall-mounted activities that support independent play and reduce loose toy clutter. These steps lower stress for everyone and create a better first impression. I joke sometimes that a good waiting room can do half the doctor's job. If kids arrive calm, the appointment's already halfway done.
I like that. All right, so thinking practically here, have you seen this work in real settings?
I actually have a quick story. I once visited a pediatric office with my nephew. The waiting room had murals, soft lighting, and interactive wall panels. He was nervous going in, but by the time they called his name, he was calm and curious. That positive start made the whole appointment smoother.
That's exactly the kind of ripple effect we're talking about. When kids leave with a positive impression, they're more receptive to future visits. Trust builds over time. In other words, a single good experience can reshape how a child views healthcare going forward.
Exactly. And it's not just about the kids. When parents see their child relaxed and engaged, their own stress drops. That emotional shift spreads to the staff, creating a more compassionate, efficient environment for everyone.
So, to everyone listening, whether you're a practice manager, healthcare administrator, or just a parent, what's your waiting room saying about your care philosophy? Thanks for tuning in. We'll catch you next time.